Hello and welcome to Community Health Journal. We begin today with advances in medical technology and how they extend the reach of critical specialties to communities in rural parts of our region. Catholic Regional Medical Center and the Providence Health Telemedicine program have developed key partnerships with health organizations in Southeast Washington and Northeast Oregon. We recently visited Dayton to find out how these alliances have brought a higher level of care to the community located at the base of the Blue Mountains. The Tri-Cities and Dayton are separated by more than 70 miles, but they are frequently linked electronically to bring life-saving treatment to patients in the midst of a stroke.
All right, I'm going to ask you to do a few things.
Okay.
I want you to squeeze my hands hard as you can.
I can't squeeze.
Okay. Oh, I want you to hold your arms out like that. Can you do that? Okay, left side, nothing.
You're watching a simulation of how stroke patients can be treated in the Dayton emergency room using telehealth. On the screen from his office in Seattle is neurologist Dr. Todd Sartosky, who in consult with Dr. Neese can diagnose the severity of the stroke and determine if a life-saving clot-busting medication can be given.
Time is brain, as we say. So the faster you can start definitive therapy, the less devastating a stroke can be. And I've seen many times when someone comes in with very serious deficit, the thrombolytic drugs administered, and they have a total recovery.
Giving this medicine has a huge benefit. It also has a significant risk tied to it. It can cause bleeding if it's given incorrectly. So really it's a decision that's made in conjunction with a stroke doctor, an ER doctor who's physically there in the ER, and of course the patient and their family. So having access to a stroke doctor 24 hours a day within minutes is very important to be able to treat these patients who are having signs and symptoms of stroke.
Okay, can you raise your left leg? Left side's totally flaccid.
So his NIH stroke scale, he would have 4 points for the arm and leg, since I see no movement whatsoever, and then the sensation probably a 2. That gives him at least 10 points on the NIH stroke scale.
Not only is Dr. Sartosky a neurologist, he also heads up the telehealth program of the Providence St. Joseph system, of which Catholic Regional Medical Center is a part of. Catholic's telehealth program, led by nurse Cass Bilodeau and her skilled team, have forged important relationships with rural hospitals around the region, like Dayton General.
This is a partnership in bringing the specialists in to this community in a timely manner when the patients need it. It's really about meeting the needs of the community where they need them to be met. Dayton has been a great partner. We've worked collaboratively for years, and we're just excited to keep exploring opportunities for partnerships and expansion of services.
That level of partnership and collaboration makes all the difference in the world. I mean, this is not just a relationship, it's a partnership.
Shane McGuire is the CEO of Dayton General, part of the Columbia County Health System. He can't say enough how much his organization and community appreciate the relationship with Catholic and Providence.
We send patients off for surgery, you perform the surgery, we rehab them in our swing bed program. And so really that dialogue and that care coordination that happens between the two institutions is incredibly valuable.
It goes back to, it's about the patients. It's about the people in the communities. It's about all the people that are working in these facilities, and one, you want to meet the patient's needs.
I mean, obviously he's had some sort of significant neuro event. We'll see what the CT shows, and I think we'll activate life flight if they can fly.
Everyone we talked to stressed the importance of partnership. Dr. Sartosky said he knows firsthand the challenges providers face in rural communities.
It resonates with me. I mean, I grew up on a farm, so middle of nowhere back in the Midwest, and I can tell you that access to specialists like a vascular neurologist just didn't happen. They just weren't available. So the beauty of telestroke and the power of it is that ability to import a specialist 24 hours a day into a community that otherwise you would not have that expertise.
I really think this is the coming thing, and not just for neurology, but I think for a lot of areas of medicine. It's going to expand care into rural environments that just don't have it now. I think it's an exciting development.
Cadillac's presence in rural healthcare is driving improvement in care in the rural communities in Washington State, certainly Eastern Washington. I know that there are several hospitals that you work with, not just Dayton, and I think that that's commendable. That you're elevating the quality of care at these rural institutions, and it's very forward-looking, and I think I'm looking forward to what we can do in the future.
So from Dayton to Prosser, Enterprise to Irrigan, Cadlick and Providence are expanding the reach of specialty medicine to all corners of the region.